Clomid, or clomiphene citrate, is a class of medication called a selective estrogen receptor modifier, which is a very fancy name. But essentially its purpose is to fool the body into thinking that there isn't a very high level of estrogen. At the very beginning of a menstrual cycle, when the estrogen level is low, the brain responds to that by encouraging the ovary to produce eggs using a hormone called the FSH, or follicle stimulating hormone. When the brain can't sense that a follicle is growing, it continues to produce FSH hormone, which stimulates the ovaries a little bit more than it would if it could sense that a follicle was growing. And so Clomid is a mild stimulant that can produce 1, 2, or 3 follicles typically in order to get them to eventually ovulate. It can be used in women who don't ovulate ever, and sometimes as a way of provoking ovulation. And in some women who do ovulate, it can be used to get additional eggs to increase the probability of a successful pregnancy at the end of that cycle. Typically, depending on the age of the patient, we will offer between 3 and 6 months of Clomid treatment. If it hasn't worked after about the 3rd or 4th month of treatment, then the number of additional women who can expect to become pregnant in the 5th or 6th months is actually quite small. And so for women who are older, it makes very little sense to continue giving them Clomid if there are additional treatments that have more success associated with them